The Confident Stock podcast is brought to you by My Evergreen Medspa. Located in Houston in the Woodlands, My Evergreen Medspa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Medspa, it's me time elevated. Welcome back to the Confident Stock Podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in Houston, Texas, part of my Houston Surgeons. And today we have a special guest. We have, and I'm going to pronounce it correctly, Dr. Algie LaBrasca.
Correct.
All right. Welcome to the show.
Well, thank you. Thanks for having me. I appreciate it. I'm super excited.
So I always like to start off with, how did you become a plastic surgeon?
So my story is that it actually goes back to when I was like 3 or 4 years old. Both my parents worked, and my grandmother took care of me. My paternal grandma, so she would take care of me. So she was my person. I would spend all of my days with her. And grandmothers are super powerful. So she would take my hand and hold it in her hands, and she would say, "Oh, Algie, you have the hands of a doctor. You need to become a doctor someday." I was like, Okay, sounds good. All I knew about doctors, that's the one that gave me the shots all the time. And so as I got older, a little older, I said, yeah, sure. And then when I was 12, she got diagnosed with melanoma, and she died within about 6 months. And so I decided, hey, I was going to become a doctor for her. I went into med school. I think I finished or was close to finishing med school, got into a general surgery residency, and then I felt I didn't know how to suture very well. And so I did a plastics rotation towards the end of medical school, and I had the best time, and we treated melanoma, and we saved lives treating melanoma. I went, yep, this is it. This is what I'm going to do. So I spent the next 5 years of general surgery residency, just beg, borrow, and steal, trying to get in as many plastic surgery cases as possible. And here we are.
That's awesome. How long have you been in practice?
I've been in practice 15 years. So I graduated in 2010.
Nice. And are you, what area of the country are you in practice?
So I'm located in Western Pennsylvania, near Pittsburgh. I have a med spa in Pittsburgh, and then my plastic surgery practice is located about an hour and a half north of Pittsburgh.
And that's kind of the area you grew up in, right?
Yep. My one office is like a mile from the house I grew up in.
That's awesome. It's nice. It's nice to be back in your own community, right?
Yep. It really is.
So let me ask you, have you always been in practice by yourself? Like, did you hang a shingle and went for it? Or has this been like a process for you to get to where you are now?
So I came in as a hospital employee in 2010. And I was the first plastic surgeon in my area. They didn't really know how to handle me. They didn't really know like what to do with a plastic surgeon. So they started, they treated me like family medicine. They said, okay, here's your shingle. We'll send some people to your office. And, it just never really took off. It wasn't really my thing. And so after about 3 years, I decided to go into practice on my own, and I rented some space and was kind of partners with a local optometry ophthalmology practice that has like 9 locations and multiple surgery centers. So I in addition to doing regular general plastic surgery stuff, I took up oculoplastics and did thousands and thousands of blepharoplasty and other oculoplastic cases. And then I continued to just grow my practice, and I became LaBrasca Plastic Surgery about 2.5 years ago. And here we are.
And things has been doing really well since then, right?
Yeah, it's a lot of fun. I pivoted to mostly body about 5 or 7 years or so ago. And then with COVID, it just really took off for all of us, including me.
Are you still doing oculoplastics as well?
Yeah, I still do I probably do about 200 blephs a year. maybe a little bit more, and I do some other things like ectropy and entropion repair, ptosis repairs, and some cancer cases as well.
That's right. A lot of plastic surgeons don't do ptosis, especially still with island stuff. So that's great that you're doing that. Obviously,
Yeah,
you had a
there
lot
was
of
nobody else around, and there were thousands of patients that needed it. So I had only done a couple of ptosis repairs in my residency, but the one ophthalmologist kind of took me through a few cases, and I improved with time. Repetition is the key to adult learning, and I had a lot of reps.
Absolutely. And I know you do, like you said, a lot of body contouring. What would you say is kind of your favorite procedure to perform?
So, these days, what I'm known mostly for is my tummy tucks. My belly button is what brings folks from all over. Again, I'm in Pittsburgh. Yesterday, I had a patient who came from California, and they just kind of come from all over. I had an Alaska patient last month. That's what I'm mostly known for, but and I'm blessed and I'm thankful, and I do that, but I do a bunch of other stuff too. So,
well, I could say, from watching you on social media and stuff, you have a great personality, and I could see why people come to you because, you, and I like this too. I like to inject a lot of humor into what I do. So I feel like when you started, you have a pretty active social media account. When you started doing that, what was your kind of goal with it? Or you're like, let's just try this, let's see what happens?
Well, yeah, really, because so we got shut down with COVID, right? And I practically lost my mind, right? I was stressed and I was worried, and I have all this energy is real. It's like this literally every day. And I had no outlet, and I didn't know what to do with it. And we were shut down, and I was seeing like 3 patients a week, okay, just like dying, and where I live, it was only for like 6 or 8 weeks, but it was enough to scar me for the rest of my life. And so I just decided, heck with it. I'm going to make my area the United States, and I'm just going to get on the internet, and I'm just going to be me, and I'm going to talk about whatever the heck I want to talk about, and I'm going to just address. I decided it was no longer going to be like stiff. I was just going to show who I am. Some people aren't going to like it. Some people are going to like it. And, so far, so good.
What's interesting is we actually had someone on our podcast earlier today who basically was talking about personal branding in the sense of like revealing who you are. People are flying to you from all over because they connect with you. And they're like, wow, I love his results, but clearly they love you too. And so I love that because you really have to be authentic to start getting people who are not just in your neighborhood.
Yep, exactly. And it was a surprise. My goal, when I really started doing it, when we opened up after COVID, I said, you know what? I'd like to do first, maybe one patient a quarter. And then I'd like to get someone to travel per month. And I said, if I could get 2 patients to travel per month, that would be incredible. And, I never in my wildest dream imagined it'd be 5 patients a week and
yeah,
stuff like that.
So,
we've got a little map there. We've got almost all 50 states.
Do you have little pins and stuff?
Yep.
That's awesome.
Yep.
Yeah.
We're somewhere in the almost to the mid 40s, almost 44, 45.
That's fabulous. You're going to hit them. You'll hit them all.
Yeah.
It's
it's tough to, in Pennsylvania, it's tough to get Montana. It's tough to get, so I've got all these states, and then right in the middle, I don't have anybody from Kansas. So if you're listening, let's go.
Come see him. This brings up a really good point. I take care of a lot of out-of-state patients too, and there's challenges to that, right? Because you want to give that same level of care to the people that you see locally as to people that you're taking care of. So how do you do that in your practice?
So it's very tricky. So one of the things that I do is I make patients stay longer than other people do. If you fly, I always say if you fly in, you have to stay 2 weeks. That no exceptions. If you come from a closer state, you can stay a week. And then if you get a tummy tuck, you have to be a 1 week in person and a 2 week post-op in person, and everything else can be virtual after that. So I have a patient now from Kentucky today. Today was her 2 week post-op. She stayed for a week. And then and she went home, and then 2 or 3 days ago, she messaged me. She's like, I'm really feeling tired. I don't, and my drain output's a lot. And I was like, well, geez, if she was close, I would just bring her back. I would see her. So I ordered some labs and we did a virtual consult, and she looks good. Her hemoglobin was a little bit low, but her drains look good, and it was serous sanguine. It's basically non-bloody for those of you that don't know. And so I felt good. I gave her some iron and she was fine. I saw her today. She's good. And, she's just going to take a little bit longer to recover.
Do you teach your patients or family members to take the drains out, or do you have them go see somebody to do that?
I do it. I do it. So, or like one of my PA does it. I have a nurse that's been with me for 10 years, almost 11 years. She does it. So yeah, I do that. I've had a couple of times where I have had someone have their family doctor do it, but I'm pretty strict about it. And it's saved my butt,
Oh, of course. No,
times.
but I mean, if they're out of state and it's past that
so,
time, you still ask them if they can't come.
If someone leaves my area after 2 weeks with a drain, I make them check with their family doctor to make sure that the family doctor will take it out before I let them go.
And I know for you, an important part of taking care of patients is also taking care of their mental health. So how do you balance that, especially with having people who aren't necessarily always going to be able to come into your office?
Sure. So I talk to them. They all get my phone number. It's the same number that I'm calling you on right now. If they need to message me, they can message me. If they need to call me, they call me. We do FaceTimes, anytime they need me, and we go over stuff. And I tell them, these are the things you're going to experience physically, but also somewhere around, day 4 to day 12, you're going to lose it. You're, mentally, you're just going to be like,
what did I do?
I can't do that. I'm ready to be better. I want to be done feeling crappy and being sore and waking up, 12 times in the middle of the night. And I just say, hey, listen, this is what we talked about. We said it was going to be tough. What I tell patients is the first week sucks. The second week sucks a little bit less. And
that's spot on. Yeah.
I say those words. So and if they're like, boy, that first week was tough, I just say, listen, I never told you it was going to be easy. What do I always say? And they say the first week sucks.
Yeah. Yeah, it does. But I mean, most things we want take a little bit of time sucking in between there. What are some other things that you feel like are unique to what you do for your patient success?
So, it's just repetition. It's telling them, hey, this is what you're going to expect the next 3 days. This is what you're going to expect in the next week. This is, and when they see that, they're like, oh, okay, he knows what he's talking about. And it's that, and we help them. And, it's from the get go, folks. I had a woman who's coming in from North Canada. I can't remember one of those. Like Alberta. Is Alberta far west?
All Canada's North Canada?
I think it's Alberta. But she's way up there.
Yeah.
And I had to this is the area you're coming to. It's part of it is pretty rural. We can help, these are the hotels that I've vetted. These are the Airbnbs that I've vetted. And you're going to come in and this is what's going to happen this day. And this is and I talk them. They have the initial consult, and then they have a pre-op consult within a month before surgery. Usually it's a couple weeks, and I say, this is what I want you to do between now and the day of surgery. We're going to then talk about the day of surgery and then the first week after surgery. So, and it's just we go over that, and my staff knows as well because they do a lot of the same thing a lot of times, and so staff training is also super important.
Right, because I mean they're an extension of you, and you want everyone to feel like that. No matter who's taking care of them, that like they're getting the same care you're giving them.
Yep. Yep. Exactly.
And what I hear from what you're saying really is communication. That's a
Yep.
big thing, right? Is that they know
Yep.
they can reach out to you and that you got their back. You know,
If they know they have my number and they can reach me if they need me, like very rarely does that get exploited, and if it does, it's only for a day or two, and it's because they're scared. Um, it's 20 years ago when we didn't have cell phones, but before I was a plastic surgeon, I remember beepers and right. And so like now my patients can be like, hey, is this normal? And they send a picture. I'm like, yep, that's normal. No problem. Go back to sleep.
I actually prefer that to me having to return a beeper and like, yeah.
Yeah, right. Like
Yeah.
that was our predecessors would have to drive and then stop at a payphone and talk to their patients in a phone booth and have their patients be like, okay, so it's really red, or it's like a little bit red, or it hurts here, where's here, okay, and I that would just be super difficult. And then, okay, well, I can see you in 3 days, and the patients would stress for 3 days and find out it was nothing, whereas now it's like, okay, you're good, or I'll see you tomorrow, or I'll see you in the ER in an hour. Like, the technology is trouble, but technology is also, if you let it be, super powerful and helpful.
Exactly. And like you said, it's opened up so many more people. Like there's so many more people who can now find you and you can take care of them and they can get their good belly buttons. So it's like
That's
it's
right.
win-win. That's right.
Right. How did people find their plastic surgeon 20 years ago? Then look at the phone book, and they would open it up and they'd find the plastic surgeon with the biggest ad in the phone book and be like, well, that's the one that must be the best because he or she's got the biggest ad in the phone book. People are like, why would you find your plastic surgeon on TikTok or Instagram or Facebook or whatever? Well, now, because you've got, I've got 2,000 videos on TikTok, and I've got 1,000 videos and stuff on Instagram, and they know what they're getting by the time they see me. And same thing for you.
Yeah, exactly. And the thing is, right, like there's so many styles too, right? So someone might want this style or that style. Now you can like basically window shop, right? Like for what you want and find exactly that, not just the style you want, but the personality of the surgeon you want. Because some people like someone who's going to be really serious and straight all the time. And that's probably not you or I. But, but that way you really find that person that's going to click with you,
Yeah, absolutely. You're right. I'm not for everybody. I'm definitely not. And I'm okay with that. I know who I am. I know who I've always been. And yeah, I'm not for everybody. But if you want someone who's going to do a great job and also, cheer you on, that's me.
So I always like to ask, what devices do you have? And like, what are your favorites? Like, what do you like to utilize them for?
Sure. So we have VASER for lipo, and we have power assisted lipo, and that's great. And then at the med spa, we have a couple of lasers, which I just got a laser today. You can check out. I'm a little toasty, but I'm 51, so we're trying to keep this thing, as good as it can get. And so we have two Lutronic lasers. We have the Genius and the Ultra, and then we have a vascular laser as well. And then we have other smaller devices, skin pen, and some other things like that.
When you have somebody who comes in, let's say for body contouring, do you often talk about other areas like, okay, hey, let's like explain like facial things like that, or usually like to kind of focus on what they're in there for? I'm always just curious again, like, because some people like to like have a checklist and be like, check everything you need to talk about. Or are you just more of a focused person when you meet somebody?
So it depends. So if someone comes in and they say, hey, I lost 170 pounds and kind of everything is a mess, I'll say, all right, let's talk about, here's what we'll do. Let's talk about this. Let's talk about this. Let's talk about this, and then, put it together and try to coordinate a plan. Do they want one surgery and they just want to focus on here? Do they want to, have a plan over 2 or 3 years, then we plan that. But if they say, hey, listen, I really, if they come in super saggy and they want a lift, they don't want implants, I say, hey, we can do a lift, but it's maybe not the right thing. But also, I had a woman last week who had implants, and she'd had them for a while, and she was a triple D, but she's 60 and thin, and she said, well, I'd be a little scared without implants. And I looked at her and I examined her, and I said, listen, I can give you a perky D without implants, and you don't have to worry about them anymore. And she said it took a little, talking to make sure that we were both on the same page. Did it, saw her back today. She looks amazing. She's happy. And, so yes, I address that as well. For the face, I had a facelift consult today, and she's 67 and things are a little droopy. The neck is the biggest thing, but also she never had a bleph, upper or lower. And I said, hey, we can do just the face and neck lift, but when I'm done, you're going to wish I did your eyelids too. So I said, here, we'll give you 2 quotes, just the facelift, and then we'll give you a facelift and the lids.
And I know sometimes people come in and they're like, well, this is just what I want to do. But that's also where you come in and you're trusting us. So it's like sometimes when we're looking at that, because the last thing you want to do is be like, oh, I look so much better. But, right here, I should have done something. And we do this all the time. And so we're always looking at you as a whole when we're talking about things.
Yep, absolutely. There are patients that are just, I only want to focus here. That's all I want to do with. Okay, we'll talk about this. Just so you know, though, if we do this, this is what you'll get. No pressure. I don't pressure folks. There are still people who say, hey, if you do this and you schedule, tummy and breast today, we'll give you 20% off it. I hate that. Like, I think that's just so low rent. I just do. Likewise, though, I don't, and I hope you don't do this, but I really don't know. I was super surprised when I found out that people still upcharge for things that should be basic. Like if an abdominoplasty, they'll charge for a muscle repair. They'll charge extra for a Mons lift. Meanwhile, that's part of the surgery. Like I think it's crazy that people charge extra for something that is part of the surgery, and that pisses me off. And it's just not I don't think it's a good look for our industry.
So I 1,000% don't do that. And I 100% agree with you, because there are definitely people, I practice in Houston, and there are definitely people who still do that. Every little piece is that. And I'm sorry, but your Mons is part of your tummy tuck. Like, no one, you can't, no Mons left behind.
Right.
You don't neglect those.
Right.
And from my standpoint and your standpoint, that's my work. Like, if I wouldn't want somebody walking out looking like that, But yeah, I know people who do that for all sorts of things, like literally someone who is going to get a cosmetic breast reduction but so big needed nipple grafts and was told that it would be extra to put the nipples back on. I'm just like, are you kidding me? Just charge a price, Right,
that's gross.
Yeah. That gives us as plastic surgeons a bad name, you know, and that's the thing is, every once in a while we do get people who call and they're like, well, if I do X, Y, and Z, do I get extra discounts? And I'm like, listen, I don't do all of that, but what I can promise you is that I'm going to give you 1,000% of my attention. I'm going to do the best work I can do, and I'm never going to piecemeal you afterwards. Like, you need me. I always tell people, you're my patient for life, right?
Yep.
And I get the feeling it's the same for you. So it's like, it's not worth doing the dime penny pinching on things, because then that's the result sometimes you end up getting.
Yep. We make a nice living, and I couldn't live with myself if I stole extra money from someone's mom because I told them they couldn't get a Mons lift unless they paid extra for it.
Yeah, no,
it's gross. I hate it.
It is. So what are some things that you're excited for? Maybe just for your personal practice, like your personal growth, but also that you're just excited in the field of plastic surgery.
So what do I'm excited and nervous. So this is not really plastic surgery, but it's the new technology that's out in the world, and I don't mean, I'm talking about AI. Like I think that AI is going to be extremely helpful to us, but it's also going to be wild and uncomfortable, and it's good. There's going to be a wild west in the whole world coming up in the next 5 years. We're going to tangent for a second. I always play this game. How is your job going to be replaced by AI? And I say, like, how is people say, I had a med student on Monday, and she's like, how do you think AI is going to work in surgery? And I said, well, it's simple. Robotic surgery, for example, let's say there's 6 steps to a robotic colon resection, and I'm really good at the first 2 steps. In Pittsburgh, you're really good at step 3 and 4 in Houston, and then Dr. X in Seattle is really good at 5 and 6. So someone's going to log in, or there's going to be a patient in New York City. They'll put all the ports in, and then there'll be the on-call doctor who's like B or C level kind of training or whatever. And then when it's ready, I'll log in and do my steps 1 and 2, and then we'll say, okay, steps 1 and 2 are done. Are we ready with steps 3 and 4 in Houston? And no, we need 5 more minutes, so I'll keep working and get things rolling. Okay, she's ready. Then it'll be seamless. I'll log out, you'll log in, you'll do your steps, and then Dr. X in Seattle will finish the job. But at the same time, the AI, the robotics, they'll learn our moves because we're the best at those. So they will learn how to do those. And 5 years later, it'll be mostly the robot, and you'll be watching 5 monitors to make sure that the robot's doing a good job in 5 different places around the country. So that's going to happen. Or if it doesn't, like we should start that going now so that we can retire.
So I'm married to a pathologist, right? And I talk about Zora. It's like he's going to be easily replaced because they look at patterns, right? They look at patterns all day. How quickly could a program learn that? And like you said, there's still be double checks for to make sure. But how in some ways you could take 10 pathologists and they could look at the same slide. They could all interpret it very differently. But now you take this and you're going to be able to across the board interpret things not only quicker but your frozen section is going to get a whole lot faster.
For sure.
So yeah, so that's why he's like maybe I should look into other things. I don't know, my job's going to be around very long.
Right. Well, it's funny. There's a pathologist that I talked to, and his friend, who's another pathologist, wants to open a med spa.
That's one specialty I never saw in the med spa space.
Right.
Like ever.
Right. And it's like anesthesia. So, right now, it's 1 anesthesiologist to 4 rooms. It's going to be 1 anesthesiologist to 8 rooms, and they're going to be they're going to watch on a monitor. And here's the vitals for this patient. The computer thinks we should give a little bit more epi. We need to give a little bit more gas. Approve, yes.
Wouldn't it be great if you could program it for your favorite anesthesiologist and you're like, okay, I know I'm getting this consistent every single time.
That sounds great.
Yeah.
That's a really good idea.
Yeah. So what about for your practice personally? What are the next steps for LaBrasca Plastic Surgery?
Sure. For LaBrasca Plastic Surgery, my sister is she's a PA in dermatology for 15 years. She actually worked for Dr. Obagi in Pittsburgh. She's got, tons of experience, and we just opened a med spa last year in Pittsburgh, and we're just going to keep expanding. We're probably going to have a few different med spas. For me, I'm just going to keep doing my thing. I'm super happy. I love my job. I love what I do. And I love my patients. I'm just going to keep doing what I do and, make patients happy and expand my footprint and just have a bunch of fun while I do it. If I just coast like this for 20 more years, I'll have the happiest life and so many happy patients, and that's it.
That's wonderful. And I am all for, we also have med spas, and I'm all for plastic surgeons owning and running med spas, because I always tell all of our patients that you want to go to a med spa where if it's a surgical issue, they know the difference. Because if all you do is non-invasives, you have no idea to know who's a better candidate for one. You're just going to recommend what you have. So, but I wish you so much success, and thank you so much for being on the show. If any of our listeners wants to look you up, wants to find you, what is the best way for them to do that?
So it's drlabrasca.com. It's dr.labrasca on Instagram and TikTok. Those are probably the easiest ways, but literally I'm everywhere, or I feel like I am.
Yeah. Well, awesome.
It.
And we'll obviously have this in our comment section. So check him out. He does great work, and he is super funny. So,
well, thank you. I appreciate it.
Well, thank you so much again for being on the show. And thank you so much for joining us on the Confidence Podcast. I hope you learned something new. Tune in next time.